A 49-year-old male recently fractured a dental bridge, and now his entire right lower face is swollen. Check out the surgical treatment today on the open reduction. Welcome to the Open Reduction, your channel covering all topics oral and maxillofacial surgery. I'm Dr. Tom Bolten, and today we're draining a big dental infection. This patient is a 49-year-old male who has multiple dental needs. He has generalized carious lesions, and in addition, he recently fractured a bridge in his right mandible. Teeth 28 and 31 were the supporting teeth for this bridge, and they are now broken at the gum line. There are recurrent caries associated with these teeth, and recently the patient developed vestibular swelling in the right mandible. This area is swollen, it's fluctuant, it's very painful to touch, and it's hot. These are all telltale signs of a bad dental abscess. The treatment is removal of the offending teeth and draining this abscess to get this patient feeling better. This procedure is performed in the office as an emergency, so it's not a sedation. He was an NPO, so going to sleep wasn't an option. I administered a generous amount of local and gave it plenty of time for anesthesia to be obtained. Next, I make sulcular incisions, remove bone, and extract teeth 28 and 31. Tooth number 28 came out in one piece, but the caries on tooth number 31 went very deep, and the tooth came out in multiple pieces. I was hoping I would be able to drain purulence through the extraction socket, but there is nothing that's coming out. So now I need to make a vestibular incision to drain this infection. I make a stab incision, and immediately we can see a large amount of purulence. There's a significant amount of purulence here, and I'm going to put digital pressure to drain as much as possible. Next, I explore with the hemostat. Finally, I rinse this area thoroughly to clean all of this infectious material out. The last thing I do is place a packing so that there is not dead space. I don't want this infection to reaccumulate, so I'm going to leave this pack in here for several days and then remove it. The pack is secured and all sites are closed. This patient went home on antibiotics, prescription mouth rinse, and pain medication as needed. I saw him back 3 days later, removed the packing, and he is doing very well. I then saw him back after 2 weeks and the infection completely resolved. His pain is gone and he's thrilled to be feeling back to normal. Thanks so much for watching. Please click those like and subscribe buttons and check out my channel for lots of interesting OMFS cases like this one. Also visit my website, theopenreduction.com, for continuing education credit. I'm Dr. Tom Bolten. I'll catch you next time on The Open Reduction.